Okay, so let us begin with the last part of our cardiovascular, central, and peripheral vascular system assessment. Okay, so the equipment we will use is a centimeter tape, also known as your, what we call this, tape measure, a stethoscope, a tourniquet. If you do not know what a tourniquet is, it is a rubber band like equipment, okay, used to occlude the blood vessels. Okay, so basically it is a rubber band that is very large, and we tie it on the arm and or the leg, and we use it to stop the blood from moving. Okay, this is useful. The tourniquet is useful when it comes to, what do we call this, kanang mga wounds, kanang mga injury. Okay, a gauze and your sphygmomanometer or your BP cuff. First is our inspection. Now we have to observe the size of the extremities and venous patterns, and we have to look specifically for edema. Okay, now class, if there is a difference in size, measure the extremity or the circumference of the extremity bilaterally. When we say bilaterally, meaning I will measure around this leg and also around this leg. Okay, and then I will compare. If there is a discrepancy, chances are that is the difference. There is one leg that has edema. Now class, normally let us write here. Okay, normally the extremities are bilaterally equal in size. Okay, bilaterally equal in size. Okay, there should be no edema and no venous patterning. Okay, when we say venous patterning, what we mean by that is there should be no gross protrusion of the veins, okay, such as in varicose veins. Kada bitong mga ugat dapat walay kana bitong mga ugat-ugat, so that is abnormal. Okay, the abnormal finding for this is what we call our lymph edema, okay, such as the one shown in this picture. Okay, lymph edema. Now, lymph edema class is characterized by what we call induration. Okay, when we say induration, it is a sort of it is a sort of thickening of the tissues. So basically kana bitong murag ni baga, and it is also characterized by what we call non-pitting edema. Okay, non-pitting edema. When we say non-pitting edema, it is the type of swelling that when you press it, and it depresses, when you release the pressure, okay, when you release your finger, it immediately rebounds back into place. Okay, it is immediately rebounds back into place. Okay, this is caused by blocked or occluded lymphatic circulation. Ayan, lymphatic circulation. Okay, so as you can see, in this picture, there is asymmetry. Okay, one leg is larger than the other. Okay, this one is larger, this one is normal. There is a discrepancy. Ayan. So these are the 4 stages of lymphedema. Now take note, class, we will simplify this as much as possible. Since these are stages, it means there is a sequential factor to it. So usually starts at stage 1, and if it is not treated, it will go on to stage 4. So let us simplify it. In stage 1 class, usually it is asymptomatic, meaning there is no physical or obvious physical signs. There is no obvious swelling, but there is still abnormal lymphatic flow, diba? But we just cannot see it. So that is stage 1. Okay. In stage 2 class, there is swelling. Obviously, this one is larger and this one is normal, but it subsides when elevated, meaning if, for example, you elevate the leg, okay, when you are supine on the bed, when the patient is supine on the bed, and then you elevate the leg with some pillows, no, the swelling will subside. Mawala ang imong swelling if naka-raise ang imong tiil. So, that is the main characteristic, swelling but subsides when elevated. Okay? In stage 3 class, it is still swelling but it cannot be relieved with elevation. Okay? It cannot be relieved with elevation. And most often than not, class, no, more often than not, it is much larger. Okay? It is much larger. And lastly, class, when we reach the last stage, no, we call it our lymphostatic elephantiasis. Okay? Where there is what we call where there is gross, what we call deformation. Okay? Gross deformation. As you can see, no, the leg is too large, no, dako na kaayo, no, it is too large, no, because of excessive swelling. Okay? Another key characteristic is there is skin thickening. Usually, no, stage 4 lymphedema is obvious, very obvious when you see it. Ang tendency mong gud ana is elephantiasis, no, usually in patients like that, mga late stage na ginasa sila mga sakit. Ayan. Next is inspection and palpation. Now, we already know this, no, because we have already discussed this in our skin, hair, nails, no, our skin, hair, nails, if you remember. Now, class, normally for the skin, okay, normally for the skin, it is evenly colored. Okay, evenly colored bilaterally. Okay, there should be no changes in our extremity colors, no. Abnormal findings include obviously our cyanosis, our pallor, and our what we call redness. Okay, otherwise called your rubor. Okay. Next is our hair distribution. Now, when we say hair distribution, normally, okay, normally, it should be distributed evenly. Tana ka na ko, sir, but we are inspecting the extremities. No, this is gonna be ako masulti ninyo is this is gonna be very hard to inspect because most of the time, no, most people have very sparse, no, gamay ra like hair sa ilang extremities as opposed to your scalp, no. But we also have to check the distribution. Specifically, we have to check not check. There should be no balding spots. Okay, no balding spots. Okay, so this is the method you use to inspect palpation. Inspect the extremities, the upper extremities, no. When you inspect it, it must be bilateral. Okay, bilateral and simultaneous. The reason why is so that we can compare both sides at the same time, di ba? Abnormal findings for this class include what we call loss of hair, loss of hair. Usually, this is accompanied by shiny skin. Okay, shiny skin. Accompanied by shiny skin, no. This is caused by what we call our arterial insufficiency. Okay, insufficiency. When we say arterial insufficiency, there is decreased blood in arteries. Okay, there is decreased blood in arteries. Therefore, no, since na may decrease in blood, since there is a decrease in blood, there is also decreased oxygen in tissues, leading to hair loss, di ba? Leading to the loss of hair. Okay? And we have to assess for capillary refill time, which we have already discussed before, diba? We have already discussed that before. Next is to palpate, no, our upper extremity pulses. Okay, now class, we already know the radial pulse and the ulnar pulse. Okay, the radial pulse is commonly used. Okay, commonly used to assess pulse rate, di ba? Commonly used to assess pulse rate. Okay. Now, class, when we are assessing the radial pulse, no, the normal or normally, it is bilaterally strong. Okay, bilaterally strong. Usually, it is around a +3. +3. Whereas our ulnar pulse, no, it is oftentimes bilaterally, normal ha, normally, bilaterally weak. Okay? Around a +1 or +2. Okay? Muna siya ang normal sa imong ulnar pulse. No? Now, the radial pulse site, no? If you forgot, no? This is the site closer to the thumb. Okay? At the thumb side. Whereas our ulnar is the one closer to our pinky. So that you will not forget, +3 ni siya, diba? Kini kay +2 or +1. So that you will not forget, no? The stronger pulse is closer to your stronger finger. Whereas the weaker pulse is closer to your weaker finger. Diba? So, mo na siya, no? Ayan. Okay. So, these two images, no, this is how we assess our, what we call this, upper extremity pulses. The one in the top, this picture in the top, no, that is the examiner there is assessing what we call our radial pulse. Radial pulse, di siya dire. Now, when we are assessing radial pulse, it is best to have a bilateral approach. Okay? Bilateral approach. The reason why we need a bilateral approach is so that we can compare both sides. Okay? Compare both sides. Okay? No? It is best to have the fingers, the hands, or the palms straight up, no? So that we can have easy access to what we call our radial pulses. Ayan. As you can see, the examiner here is assessing the pulse closer to the thumb. Diba? So that is the site of your radial pulse. No? Whereas this one in the bottom, no, this is our ulnar pulse. Okay? Ulnar pulse. Ayan. For the ulnar pulse, you can use a unilateral approach. Okay? Or you could use a bilateral. It does not, there's no specific reason why. Because there is no actual need to compare, because sometimes, no, the other side, the left side, for example, is +1, while the other is +2, no? So there is no immediate need to compare. Okay? The thing you have to remember here is the examiner is assessing closer to the pinky. So, mo na siya, no? Since this is palpation, no, always remember, class, to wash hands, no, before, okay, during, and after. Okay? Aside from that, if the patient has a wound, then wear gloves. Diba? Wear gloves to protect yourself and the patient. Yan. Okay, so now we have two abnormal findings. This applies for both, okay? For both, ha? For both. Abnormal finding number 1 is absent pulses, okay? Absent pulses. Kana mga +0, okay? These are caused by what we call partial or complete obstruction. Okay, obstruction of of the artery. Okay, partial or complete obstruction of the artery. Another abnormal finding class is what we call an inelastic artery. Inelastic artery. Otherwise called your, this is caused by what we call our hardening of our vessels, no? Also known as your arteriosclerosis. Ang tendency mga good class is when we are talking about elasticity in the artery, no, it is best, no, that when you are palpating it, you have to use 2 fingers. Okay? 2 fingers so that you can also move it from side to side. Now, if it is movable, okay, normal. Okay, it means that the artery is elastic. It is elastic enough to move. But however, if it is very hard to move, you actually determine you can actually determine if you try it, then that is inelastic and therefore possibly na ay arteriosclerosis. Okay? Arteriosclerosis. Next is palpation of our upper extremity pulses. Now class, amo gyapon class no. No. If suspected to have arterial insufficiency paminaw mo we should also palpate the brachial artery if suspected ra. Okay, do not palpate if it is not suspected, no? So class, your brachial artery is notable for 2 things. Number 1, it is the site wherein we auscultate for BP monitoring. Diba? Diri man na to. This is the area we will put the diaphragm of the stethoscope, no, when we are monitoring for blood pressure. Aside from that, it supplies most oxygen-rich blood. Oxygen-rich blood to upper extremity. Okay? Upper extremity. No, it supplies that, no? So, when we are palpating the brachial artery, it is best to palpate both sides simultaneously. So, you should palpate, no, using your 2 hands, both the patient's left and the right brachial artery. Okay, the reason for that is we have to compare. Diba ito i-compare? Balik-balik naman ni class. Ito i-compare. Compare. Specifically, we have to compare their strength. Okay? Okay? When we are palpating the brachial artery, it is best to use the fingertips. Okay? When we are using the fingertips, we have to give moderate pressure. And tendency man good is the tendency is the brachial pulse site, it is quite deep, no? Sometimes even when you are getting blood pressure, you might not even be able to find it, diba? Diretso na kabutang, no? And then mo na siya compare both sides strength and rate. Okay? Normally class, the brachial pulses are bilaterally equal in strength. Bilaterally equal in strength. Pareha ra sila kakusog class, no? The tendency mong good is if there is a discrepancy, it is probably arterial insufficiency. Okay, like for example class, if it is increased, diminished, or decreased, absent rate and strength, no, it probably is arterial insufficiency. Okay, insufficiency, probably at different phases, no. Most likely if it is increased, this is the early part of the arterial insufficiency, whereas when it is diminished or absent, these are the later parts na, diba? Next is Allen's test. Now class, I have simplified this as much as possible class, no? The Allen's test checks the patency of the vessels. When we say patency class, if it is viable, if blood can actually flow through it, diba? That is when we say patency, no? One of the main reasons why we need to check for patency is usually this is a setup, no? The Allen's test, no, is a setup. It is a setup prior to ABG or arterial blood extraction. Okay, ang tendency the tendency is when we are getting our ABGs, no, a phlebotomist, usually kind of mga medtech, they will get blood. Okay, they will get blood from our arteries. Okay, latusukon og needle. The problem is since the arteries are pressurized, for example, when they get blood from the ulnar artery, pag buslot anak class, when the needle hits, blood will burst out. Okay? Because as I've said, no, it is highly pressurized as opposed to the veins, no, na dili kay siya pressurized, no? This is performed before obtaining a blood specimen from the radial artery to determine the presence of adequate collateral circulation or backup circulation. Okay? Ang tendency mo good class is something like this. Let's say for example, I am gonna get my blood in my radial artery. And as I've said, no, since it is highly pressurized, there is a high tendency that it will bleed out. Now, if it bleeds out and the ulnar artery is not patent, meaning na I block there is a block here, then the rest of the arm will have decreased blood flow. Decreased blood flow, diba? There is decreased blood flow. So we are checking for that. We are checking to see if the ulnar artery is patent. So when we inject, okay, pop, and then some blood flows out, okay, manggawas na dugo, okay, we know that the ulnar artery can still supply blood. Okay, we know that the ulnar artery can still supply blood for the hands. Okay, di ba? So that is what we call our collateral circulation or backup. Nasa backup circulation. Now, to perform the Allen's test class, it is quite simple, no? This is the exact steps. This is taken from my study notes for the review and for the board exam. Okay, so this is as simple as I can tell it to you. First is you should apply pressure over the radial and ulnar artery simultaneously. So, ikaw class, you as a nurse, you will press on these parts. Okay, the radial artery and then your ulnar artery. You will press on it. Okay, moderate pressure. This is to impede blood flow. Natana ka na ko, sir, impede nga na ito man paunungon. Why do we need to stop the blood? Now listen. While applying the pressure, the nurse should ask the patient to open and close their hand repeatedly. Okay? We will ask them to open and close. Ang tendency mo good is when you open and close, paminaw ha? When you open and close your hands while these are being impeded, blood will be forced through that impedance and then all the blood will go up. Meaning there is no blood here. No blood or decreased blood flow here. In turn, when there is decreased blood flow there, it will become pale. Okay? Or it will blanch or it will have pallor. Okay. Now, what we do next is we release pressure over the ulnar. Release pressure over the ulnar. Okay? While we are maintaining the pressure of the radial artery. Napamina mo ha? Remember, there is no more or there is decreased blood in the hands. Gamay na lang og blood sa imong hands. Okay? So, we will release the pressure on the the ulnar, no? And we will assess the color of the extremity distal to the point. Okay? So normally class, no, the blood should, when you release the pressure, the blood should immediately enter. Okay? And then it will immediately go to the tips of your finger. That is the key there. Extremity or the distal point, ang imong tips, the tips of your fingertips. Okay? After that, you repeat this with the opposite artery. Okay? Normally, class, color should return, okay, within 3 to 5 seconds. to distal ends. Okay? So when you release, okay? When you release the pressure on the ulnar artery, when you release the pressure on the ulnar artery, 3 to 5 seconds later, pak, the fingertips should now be red. Okay? Instead of pale. Okay? Ayan. That is how you do your Allen's test. It is abnormal, class, if it is if the pallor persist. Okay? If ang pallor ni mo dili mawala. Usually, if the pallor lasts for more than 15 seconds plus. Okay? It means that there is arterial insufficiency, or it could mean that there is an occluded, okay? Occluded or obstructed artery, di ba? Because obviously it is obstructed, no, because the blood cannot pass, di ba? So no need to overcomplicate things. That is the if you had trouble understanding it, mo na tong ako pinaka simple nga explanation, no? So I'm gonna link a video to show you how this is done. This is actually a commonly done procedure in the hospital. Okay. Next is inspection of the lower extremities. Now we are almost at the end, no? Observe skin color while inspecting both legs. Okay. Inspect both legs in a dependent and independent position. Okay? When we say dependent, class, it is just what you call this, lying. Okay? Meaning it is being pulled down by gravity. Okay? So this is a dependent position. It is what we call this, just swaying, no? Whereas when we say independent, class, it is being held up by a force so that it will not sway. Kini siya. This is your independent. Okay? Independent. No. Bali the class. I'm sorry. This one is independent. Okay? This one is a wait. Ay, sakto gid. Nabuang nako. Okay? This one is a dependent position. Okay, and this one is an independent. No? Ato lang i-confirm. Wait. Yay. Asa mo to? Signs. Ang koan manggod. Ay. Lah. Sabtoy. Kadyo sa klase, I'm just reading my notes just to confirm para sure gid ta kay kuan mo good. It depends on the context of the phrase pang good. I'm gonna try to use no unsay much better na gamiton. Okay? Management. Ayan. Sakto lagi ni. Okay. Dependent, no? Dependent. This one is independent. Okay. Dependent, dangling mong dangling legs. Okay. Dangling legs. Ayan. No? So, when it comes to that, no? Normally, the leg should be pinkish red. Okay, pinkish reddish color with no pigmentation regardless of positioning. Okay, regardless of positioning. Okay, now here's the thing. You have to remember, the normal findings, these are usually seen in the dependent position. This is not so commonly seen in the independent position because if you look at the anatomy right now, no, blood can easily move towards the end, but it can also easily go back. Dili parehas sa, it is not like our dependent, no, where it is affected by gravity. Now, for our dependent, no, if it is pale, okay, if there is pallor, during the dependent position, if it becomes pale, that is possibly arterial insufficiency. Okay, arterial insufficiency. However, class, if it is what we call this, if it is cyanotic, when we say cyanotic, kanang bluish discoloration, okay, bluish discoloration, it is possibly venous insufficiency, no? Venous insufficiency. Now, ang tendency mong good is when we are talking about arterial koan, when we are talking about arterial insufficiency, no, the management is dependent position. Okay, para mawala, so that we can koan, decrease our arterial insufficiency, what we do is we put the patient in a dependent position. Now, sir, ano mo naglibog naman yan, lilibog naman sabton, sir. Ang tendency man good is usually arterial insufficiency is not caused by it is not caused by the problems of venous, diba? Ang problem sa venous is it cannot easily go up because it is not pressurized. The problem with arterial is mostly kana mga occlusion, okay, or mga obstruction. Okay, now if the obstruction is obstructing the kuan, no, if the obstruction is preventing blood from going down through your arterial blood vessels, what we can do is we can help it with gravity. We will put our legs in a dependent position so that blood flow can flow downwards. Okay, para ma-relieve na to atong pallor. Ayan. So, next is we have to inspect for lesions or ulcers. Normally, there should be no lesions. Okay? Normally. However, class, our abnormal findings, as I've already tabulated, no? It could be either an arterial insufficiency lesion or a venous insufficiency lesion. Now, these are the defining elements. For example, our arterial insufficiency lesion first. Smooth and even margins. Usually at the pressure areas. When we say pressure areas, these are the parts of the lower extremities that are exposed to movement, like our toes, diba? Or our lateral ankles or the side of our ankles. Usually it is circular in shape and it is pale black to dry and gangrenous ulcer base. So if you look at this picture, it is the one in the left. Okay, as you can see, it has a smooth base. It has dark or black or gangrenous bases, no? It is circular in shape. Okay, circular in shape, and it has even margins. We can actually see unsa siya na shape, diba? We can see what shape it is. Whereas our venous insufficiency lesions, no, they are irregular edges, usually with bleeding. Okay, usually with bleeding. Around the ankles, no, usually on the ankles, irregular borders with a beefy red to yellow fibrous ulcer base. O base gani kining nasa sides, class. As you can see, it is slightly red, slightly dark red, no. Ang tendency man good, no, is if we are looking at this, it is very hard to differentiate. But I just want to highlight, no, ang edges gid mo'y, the edges are the big giveaways. Usually, if it is arterial, it is circular in shape. Okay? Na mga tanong ka na ko, sir, why is there bleeding in your venous insufficiency lesions? Simple, class. Okay? If you remember, our veins are much thinner compared to your arteries. Diba? They are much thinner. Meaning, even though it is not pressurized, a small amount of damage could enter, no, or could break through that layer. And because na i-break through sa layer, obviously there is bleeding, di ba? So mo na siya. Next is we have to inspect for edema. Okay, na nasa tayo inspect for edema specifically of the legs. Now, we have to inspect the legs, no, for unilateral edema or one-sided edema or bilateral or both sides have edema. Okay, ang duha ka tail ang naay edema. When we say one-sided, only one leg. Okay? If the legs appear asymmetrical, meaning there is a difference in the size or the circumference of the legs, use a tape measure to measure 4 different areas. Mainly among which is the calf, also the mid-thigh, nga ridapit. Okay, mid-thigh, number 1. The calf, which is around here, number 2. The superior ankle, nga ridapit, number 3. And the forefoot, which is here, number 4. Okay? You will do this for both legs, no? Use a tape measure in 4 different areas. You will do this for both legs, okay? Both legs. And then you will compare and document measurements, okay? Measurements. Ayan. Normally, class, no? Normally, it should be identical or bilateral in size and shape. Meaning, both legs, no? Both legs should look the same. Okay, just mirrored, di ba? Kay left and right man. Di ba? Kay left and right man. For our abnormal findings, no? It is dire bilateral versus unilateral edema. Okay? Bilateral edema, class, during bilateral edema, the veins, tendons, and bony prominences are not visible. Okay? When we say bony prominences, these are the palpable areas wherein it is quite bony. Like for example, if you touch the side of your ankles, there is a bone there that is slightly protruding. That is a bony prominence. Okay? That is for bilateral, or both-sided, or both sides. This is usually caused by a systemic problem such as heart failure, di ba? Or backflow. If there is backflow in right side of the heart failure, it might backflow back down to your legs, di ba? This can also be caused by prolonged standing or sitting, such as during varicose veins. Okay? Usually both legs are affected. Mo na siyang obviously bilateral man. Okay? When we say unilateral edema, the veins, tendons, and bony prominences are only visible on unaffected legs. So if you have 2 legs, kini siya, and one has edema, like this one, kini siya na edema, kini siya kay normal. This one is edematous, and this one is normal, no? In the normal leg, you can still see the outline of the veins, okay, under the skin. Whereas in the edematous, you can no longer see it because the edema is too thick. Baga ra kayo, too thick to see across, no? Lisod kay kita, especially kana mga very deep or very late stage edema. This is often caused by venous stasis due to venous insufficiency or obstruction. Okay? Venous insufficiency or obstruction. Now, there are differences in diameters for both legs unaffected. Usually, class, there is a 1 centimeter difference between the left and the right ankle, depending on which is the affected or unaffected part. Okay? There is a 2 centimeter difference in the calves. Okay? There is a difference in diameter. So, for example, class, this is the leg number 1. Okay? And this is the leg number 2. If the ankle, if this ankle is, let's say, 7 centimeter, and this one is 8 centimeter, that is a 1 centimeter difference, and therefore it qualifies as edema. Okay? Ayan. Shit. Next is a palpation of edema, no? So this is to determine the type of peripheral edema. Now, there are 2 types. First is our pitting. Next is our non-pitting edema. Okay? If edema is noted during inspection, palpate the area to determine if it is either pitting or non-pitting. Now class, let us not dili ta maglibog-libog class, no? Normally there should be no edema, di ba? Normally there should be no edema, obviously, di ba? However, class, there are two abnormal findings. Obviously, we have our pitting edema and our non-pitting edema. Non-pitting edema. Now, pitting edema, class, is usually caused by systemic problems. Systemic problems. Ang tendency mong god is during pitting edema, the edema is mostly fluids. Okay? Mostly it is lymph or not lymph. Mostly it is water. Okay? Water. Water sometimes na i-pass, but mostly it is water. However, class, no? If it is non-pitting edema, class, it is usually a lymphatic problem, such as your lymphedema, lymphatic and or endocrine problem. Okay? Ang tendency mong good, class, is in pitting edema, the reason why it creates a pit, no? Like in this picture, no? Tanawa. If you look, the examiner is pressing on the edema. When they released it, naaghapon ang pit, 'di ba? The pit is still there. No, so that is a common sign that it is a pitting edema. No, pitting edema na siya. Ang tendency mo is during pitting edema, no, usually, as I've said, it is usually just water. If it is just water, it will not quickly rebound because obviously water naman siya, diba? It is like pressing on a water balloon. Yeah, pressing on a water balloon, and the water balloon is made out of rubber, diba? It will not rebound immediately. However, manggod, if it is non-pitting, ang tendency is the edema is usually filled not only with water, but sometimes there could be pus, there could be lymph, there could be bacteria. Ang ending na is it has an amalgamation, no? It is a collection of different substances, and because of that, it acts as a sort of thick layer. That's why when you press it, it will not pit. Diba? Because there's too much in there, no? So this is what we call the next slide is what we call our pitting edemas grading. Now, when there is pitting edema, it is always important to document. Okay? If you find pitting edema, it is always important to document. Okay, document. When you document, no, it is important to note the site. Okay, if it is either right or left, lower leg, ankle, thigh, ana. It is also important to determine the what do we call this? The type, no? The type, if it is either pitting or non-pitting. And if it is pitting, grading. Okay? You have to add the grading if it is pitting in edema. Okay, ayan. So, mo ni siya atong grading, class, no? Our grading is graded on the basis of the depth, no, sa kalawom, how deep you can press it. Normally in grade 1, it is 2 millimeter depression. Okay? Ang kining grade 1, class, when you release it, it will rebound back in less than 1 second. Okay? When you press it, no, it will rebound back in 1 second. In grade 2, no, when you press it, no, and when you release it, it will rebound in around 3 to 5 seconds. Diba? For grade 3, no, it is 5 to 6 millimeter deep pit. Medyo lam-lam lagi siya. And this is very slow to rebound. Okay, very slow to rebound at around 10 to 12 seconds. Okay? And lastly is our grade 4. No, this is a very deep pit, about 8 millimeters. Sometimes even maabot na siya mga around 11 to 13 millimeters. Okay? Lawom na kina, class. Very deep. Okay? It will rebound at around 20 seconds. So that is very weird, no? Imagine pressing an edema. imo na siya gipindot, you press this, okay, and after 20 seconds ingan agyapon niyang now, di ba, after 20 seconds it still looks like that. Now that is now categorized as our grade 4, di ba, because it took too long to rebound. Ayan. Okay, so next is the palpation and auscultation of the femoral artery or the femoral pulse, no? If you remember, no, the femoral artery, it provides most of the arterial blood to the lower extremity. Okay? It provides most of the, what we call this, arterial blood or oxygenated blood to your lower extremity. Muna siya nag-provide, no? The femoral artery. Now, for palpation class, now listen ha. There is a few steps. Number 1 is we ask patient to flex knees. Okay? Flex knees. O, yan. Number 2, step by step na siya. This is how we do it. You use fingers like that. Kita mo ng picture. To press firmly. Use fingers to press firmly. Okay? Ang tendency class, paminaw ha, listen ha. Ang tendency is when you press firmly on the femoral pulse, no? You will not feel a pulse yet, especially when you press it hard. Okay? So what you do is you release, okay? Release until a pulse is felt. Okay? So you will slowly release. Imo hinaynayan og buhi, you will slowly release until a pulse is felt. Ayan. Next is assess, no? Imo assess rate and strength, obviously. And what you do is repeat on other leg and then compare. Okay? Repeat on other leg and then you compare. Repeat and compare. Okay, so that is the basic steps, no, when it comes to palpation of the femoral artery. Ayan. When it comes to auscultation class, auscultation of the femoral artery, now here's the thing you have to remember, ha? Here's the thing you have to remember. Okay? Only do if pulse is absent. Pulse is absent or weak. Okay, usually ka na mga +1. Okay, ano mga +1. When we do this class, you have to use the bell. Use the bell. Okay, ayan. And then repeat and compare on other leg. With other leg. Ayan. Repeat and compare with other leg. Now, ingani na sa class, we have normal findings ha. Normal findings anita ha. Okay, normal findings include a strong and bilateral pulses. Okay? Meaning you can hear you can palpate the pulses, no, on both sides. On both sides, and they are very strong, usually around +3. Diba? Aside from that, there should be no bruise during auscultation. No bruise during auscultation. No bruise during auscultation. Hello, bilisan mo naman. Asan to? Ayun. Now, class for abnormal findings, no, let us separate it, no? Ari. For palpation, ha? Abnormal findings for palpation. Okay, abnormal findings for palpation include a weak and absent pulse. Okay? Weak and absent pulse. Usually, mo nini siya ng mga +0 to +1. Ayan. Okay? This is caused by partial or complete arterial obstruction. Now, this is very important, no? It is very dangerous, no, if we occlude the lower leg, because ang tendency mong good is if there is an occlusion or a obstruction in the femoral artery, because if you remember, as I've said, no, the femoral artery supplies most of the oxygenated blood for the leg, no? So kuya okay na siya. That's why we have to confirm, no? That's why, class, the abnormal finding during auscultation is bruise. Okay? When we hear bruise, diba, if you remember, bruise are swooshing sound that occurs when there is turbulent blood flow, usually when there is narrowing. Okay? Usually when there is narrowing. Now, when there are bruise na, class, this confirms. Okay? Confirms na gid, ha? Confirms obstruction. Confirms obstruction and decreased blood flow. This confirms the two theories to the lower extremities. Hala. Ayan. Hala. TI. Again. And lastly, okay, pinaka-last na slide. Ayan, tapos na tayo. Okay? Palpation of the other pulses. Okay? Now, kini siya nasa left, class, no? Both in the left, these are our popliteal pulses. Okay? This one is a supine approach, while this one, class, is a what we call prone approach. Okay, as you can see, the patient is supine, but we can still assess your popliteal artery. Okay, whereas a prone approach, we can still assess it, no? So, kuha tayo, depending on the one. Normally, class, no, when it comes to popliteal pulse, normally, it is weak or non-palpable. Normally, it is around +1. Okay, weak, sometimes non-palpable. When we say non-palpable, it does not mean it is absent. It just means that it is very deep. Okay, lawom na kayo na siya. Same goes with the prone approach. Same regular pulse as normal. Obviously, we're assessing the same pulse, diba? We are assessing the same pulse. Now, this one on the upper right, this is our dorsalis pedis pulse. Okay? Dorsalis pedis pulse. Yan, dorsalis pedis pulse. Normally, class, no, when we are assessing the dorsalis pedis pulse, it is bilaterally strong. Okay? Both sides are strong. Usually, it is around +2 to +3. Okay, bilaterally strong, usually around +2 to +3. However, class, it is also normal for it to be absent. Okay? Normal, class, it is normal for it to be absent. But it is for 5 to 10% of the population. Okay? If you assess this pulse and it is absent, chances are the patient you are assessing is part of this 5 to 10% of the population. Very rare, no, absent. Mostly, it is bilaterally strong. Okay? And the last one, class, is what we call our posterior tibial pulse. Posterior tibial pulse. Okay, posterior tibial pulse. Now, same gyapon siya class, no? It is bilaterally strong. Normally, dito diri. Narita. Normally, it is bilaterally strong. Strong. Usually, it is around +2 to +3. Okay. And it is normal for it to be absent as well. Okay, it is normal for it to be absent as well. But this time, it is about 15% of the population. So, 15% of people will not have or will have absent pulses in this area. 15% of the population will have an absent pulse in this area. Okay? Okay, so mula na siya, no? Abnormal findings include what we call a weak or truly absent pulse. Okay? When we say truly absent pulse, it means both legs, no? Oh, no. It means that when you assess it on one leg, but on the other, wala siya, that is truly absent. Di ba? Because if you are congenitally absent, no? Both legs dapat absent. Di ba? Both legs dapat absent. But in this instance, no? If one leg has a pulse and the other does not, chances are the leg that does not have a pulse is being obstructed. So muna siya, no? If there is a weak or truly absent pulse, it is indicative of our arterial insufficiency, arterial obstruction, or arterial obstruction. Ayan. So with that, we are at the end of our assessment of the cardiorespiratory. These are your further readings, no? These are topics that are considered good to know, not need to know. Katong nasa taas, guys, the ones on top, mo to sila yung mga need to know. However, these ones, guys, are good to know. I know because most of them will be repeated or will be discussed in your medical surgical nursing. Actually, some of them will be discussed in your maternal and child nursing. Specifically ka ng mga heart sounds, no? Some heart sounds are discussed in your maternal and child nursing. Ayan, so good luck to you. When we come back from the break, mga around April 2 for section A5 and A6. And then April 5 for section A7. We will have a post-test covering the entire topic. So, from anatomy up until this last point. Okay? Ayan. So, good luck to you. And always remember, class, do not forget na pa mo assignment atong manual. Okay? We still have the manual. Okay? So, good luck to you.